A care coordinator is somebody who essentially educates, coordinates, and navigates for the patient.
We work closely with the providers and the medical staff to just provide extra support and guidance to the patients.
If they have any gaps in their care that need to be done, such as any sort of screenings, or if they have open referrals, let's give them a call, or let's meet them in their office visit and see what's going on and let them know why these tests are ordered, why these medications are given, because without them, they are uncontrolled and their health just continues to kind of degrade in that respect, and we don't want that to happen.
We kind of address any barriers that are stopping a patient from getting the health care they need, whether it's transportation, cost of medication. We work with them to try to work through those things.
I had a patient who didn't have insurance, and she had an abnormal mammogram and needed to have a biopsy, and the care coordinator was able to get that patient set up within the week with both a surgeon and an oncologist. It definitely made a huge impact on that patient.
Sometimes people don't know who to go to or what their insurance will even cover. Maybe you don't know who to call or who to ask the question to, and you could always reach out to us and we can figure out who you need to talk to or get that message to whoever it needs to go to. It is rewarding to see patients get that load taken off their chest, like they don't feel so scared anymore. We want to be a part of the positive part of healthcare, not the scary part where they're confused and lost. No, we've got you. It doesn't matter. We've got you.
I've been doing Pathways care coordination for like 5 years. So, there's things from seeing people's A1Cs improve, diet changes, people who were at threat of losing their homes, people that were living in their cars, that we've set them up with shelters. So we have to get those things addressed as best we can so we can get them to focus on their health.
We kind of dabble in everything, even if it's not in our job description, because at the end of the day, what we're here for is the patient. What can I help you with? How can I make this more seamless for you?
They do so much more than is asked of them. Healthcare isn't always like that. We had a parent today who was struggling to find daycare. It's not technically a referral, so really Lori didn't have to help, but I know she did spend 20-30 minutes looking at different daycares, trying to find out what we could do, who was local, provide as much education and resources.
Being a new parent is hard. So I feel like when we go in and we talk to moms and families, dads, about the resources, different programs that we have to assist them with their newborn childcare and everything, then they are so relieved. I feel like we have taken some stress off of these families.
In regards to contacting care coordination, one of the ways is when you are in office, you can ask while you're being seen, hey, can you have the care coordinator come talk to me before we leave? Can I get her business card? They can also just call the main line, let the operator know I'd like to be transferred to the coordinator at whatever location you prefer, and then we can start coordinating from there.